I would like to invite Saloni Mayekar on stage. Saloni is here. Saloni has been a founder at NIMA, working towards empowering women to make informed health decisions. She's a graduate of Columbia University. Saloni, welcome on stage.
Hi.
Hey.
It's such a pleasure to be here.
Pleasure to have you here. Would love to know from you. You've been treading the path of social impact. You've been a consultant with McKinsey or BCG? EY. Okay, she was a consultant at EY in London.
In New York.
In New York.
Yes.
And you must attend that tomorrow's launch. But speaking of New York and being a consultant there and now listening to the DLC concept, what comes to your mind first? How do we take social impact, make ourselves accountable, and get all 54 communities working?
So just to give a little bit of background, I am a Master's of Public Health from Columbia University, and I was a consultant at Ernst & Young based out of New York, and I'm now an entrepreneur. So I feel like a tiny seed in this forest of, beautiful mentors, and I'm so happy to be a part of this community, and this is such a great initiative. I was also, like Dr. Mayekar introduced, part of the Healthy Smiles initiative, where we touch lives of about 350,000 children, educating them about oral hygiene. And to answer your question, I think, as a public health graduate, it is so important to educate and at the ground level to people about health and making them aware and empowering them about the choices that they have, so they understand the decisions they make towards their healthcare, rather than just blindly following, a doctor or anybody else who are of course educated and help them out. But it's always good to sort of be empowered, and then you follow through with the decisions you make, rather than kind of just, have someone dictate them to you.
I agree and resonate with you. What intrigues me is to understand a drastic paradigm shift. When it used to come to health and wellness, all the first world countries used to always think health and wellness and medical is a problem of the third world, and we all need to help them. Today, when COVID is on everybody's backyard, everybody's couching for cover, be it New York, be it London, be it Europe, be it anybody. As bad as South America to New York, conditions have been as worse in New York as they are in South America, or they are in India. And I think this has made a level playing field for every country and every government in the world to understand how important health and wellness is. From this disparity and dismay, countries are going to leapfrog across into a new era of health and wellness for its citizens.
Absolutely. And it's going to be so important for the citizens to also take charge of their own health. Is another thing that came out from the pandemic.
It has.
When the healthcare system is kind of grappling at those levels, you have to sort of stand up and, empower and educate yourself and take charge of your health.
I agree with you. With all the money in the world, people couldn't buy oxygen or people couldn't get a hospital bed. And it's for all of us to see. So this committee has a lot of work ahead for all of us. Thank you.